Why is mortality rate key for analyzing age data? Imagine trying to understand how healthy a population really is without knowing how many people die at each age. It's like trying to read a story without knowing the ending. Mortality rate is a simple number that shows how many people die in a certain age group over a specific time. It helps us see which ages are more vulnerable and how long people tend to live. When we look at age data, mortality rate tells us a lot about the health of different groups. For example, babies and young children often have higher death rates in some parts of the United States, especially where health care or economic conditions are less stable. These early life deaths impact the overall life expectancy and shape the age structure of the population. If fewer children die young, the population gets older on average. As people grow older, mortality rates usually go up. Older adults and seniors tend to have higher chances of dying from illnesses like heart disease or cancer. Tracking how these rates change over time shows us how medical advances and public health efforts are helping people live longer. For instance, if mortality rates among seniors decrease, it means more people are reaching old age and living healthier lives. Mortality rates also reveal differences among racial and ethnic groups. Non-Hispanic Black and Mexican American populations often face higher risks of death at certain ages compared to non-Hispanic white populations. These differences are linked to social and economic factors, and understanding them helps policymakers target health programs more effectively. Knowing the mortality rate at each age helps demographers predict how populations will grow or shrink. It guides decisions about health care, social services, and economic planning, especially as the United States population ages. It also helps identify which age groups need more support or medical resources. In short, mortality rate is a key piece of the puzzle when analyzing age data. It shows the risk of death at each stage of life, highlights disparities, and helps us understand how populations change over time. Without it, we'd miss the full picture of what's happening in the health and longevity of the people in the United States.